So today I want to do something special. We'll call it the dentist confessional. So I'm going to go through a couple of the most common lies that people tell us and try and convince us are true, even though with our experience and our training, we know you're not telling the truth.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
Hi, I'm Dr. Brett Langston. I'm a prosthodontist and the owner of Dental Implant and Aesthetic Specialist here in Brookhaven, Georgia. Now, because we're nice and polite, we're probably not going to call you out on it, but these are things that we hear all the time that we know aren't true. So the first one and the most common is, I floss every day. I can't tell you how many times we hear this. Everyone comes in and claims they floss every day. Now, don't get me wrong, we do have a lot of patients that are really good about flossing and probably do floss 2 times a day or after every meal. The majority of patients, myself included, don't floss 2 times a day every day for every day of their life. And one of the things that gives this away is bleeding gums. So what causes bleeding gums? Basically, bleeding gums are a form of gingivitis, gingival inflammation. And so that just means the gum tissue around the teeth are irritated. And so what happens when you floss and when you floss on a regular basis, you're not only cleaning out the debris between the teeth, but you're cleaning down in the sulcus, which is the area between the gums and the tooth structure. And what that does, it actually strengthens up the gums and causes them to tighten down to the tooth, which is a great thing because when those gums are tightly adapted to the bone in the tooth, there's not little pockets or areas for food and bacteria to get trapped in there. So if you've got an area that when you come in to see us or all over your teeth, that when we do our cleaning and our hygienists do a great job of getting down in those little pockets, the gum tissue is naturally going to get irritated and probably bleed or at least get red and inflamed. And that's a really big sign to us that you're not doing an adequate job at home with your flossing. Now, the nice thing is gingivitis is completely irreversible. So with proper home care and the proper techniques, and our hygienists and dentists are great at teaching you these techniques, we can actually get you to reverse that gingivitis, get the tissue healthy, and then when you come in and tell us you actually floss, we'll believe you. So another thing that we see that's very common is you'll floss the day before because you're like, oh my goodness, I have a dental appointment tomorrow. I'm going to floss my teeth and make it look like I've been flossing all along. I like to compare this to if you showed up for a marathon and you had just run a day before thinking you were ready to go and everybody believed you're a marathon runner. It doesn't work that way. Your gum tissue heals and the plaque and debris is taken off the teeth by constant repeated pattern of flossing and cleaning the teeth. So in fact, if you're flossing once a day or 2 or 3 times a week, that's awesome. That's definitely better than doing nothing. But I'm just here to encourage you to try to get that ideal level of flossing every day. Number 2 is I don't drink soda or any of that unhealthy, unnatural stuff. I only drink water. I'm guilty of this one myself. I like to drink Diet Cokes, but unfortunately, if you look at the breakdown and the materials in your Diet Cokes, your regular Cokes, your fizzy drinks, a lot of times you're adding in sugar, acid, carbonation. All these things are really rough and aggressive to the teeth. It's okay if you want to have a Diet Coke or you want to have, a Sprite, or if you want to have a fizzy drink. It's just really important not to sip on them all day long. Being in the South, one of the biggest culprits we see is sweet tea. A lot of people will just have a big jug of sweet tea and they'll just sip on it all day long. And essentially what you're doing is you're bathing those teeth in a super sugary, saturated material all day long. So my piece of advice on this is if you're going to have those things, which is great because I like a nice Diet Coke now again also, just make sure you only have it at one sitting. And a lot of times if you have it with a meal and then rinse or brush afterwards, the material's all gone from the teeth and no damage is done. But when you come to see us and we see that outer enamel layer worn off your teeth, flat teeth with pits and grooves in there, it's really obvious and evident that there's some kind of acid erosion going on to the teeth. And a lot of times we can tie that back to the dietary habit of sodas, sweet tea, sugary, carbonated beverages. So along that same thought line, we can really tell if you have a bad habit of Tic Tacs, cough drops, sweets, and candies. A lot of times when you eat those or chew on those, you'll just soak the gum line in saliva, just saturated with sugar and those bad bacteria. And a lot of times you get very obvious decay right at the gum line, whether it's at the edges of crowns or just right where the tooth meets that gum tissue. And that's a really telltale sign of dietary habits that involve sugary substance just kind of held down in that gum tissue. And that kind of hammers home the importance of coming to see us so we can take x-rays and we can make sure that that decay is not a lot deeper and it can be fixed with just a small filling and a change in your dietary habits. Lie number 3, I don't smoke or vape. While it's socially unacceptable nowadays to really smoke or vape or let people know that you have that habit, please be honest with us. We're not going to judge you. And a lot of times we can tell anyway, even if you deny it, because one of the most common side effects of smoking and vaping is that you're damaging the gum tissue and the teeth to a point where you may not see it, but we can really tell. In addition to that, you reduce the salivary flow, so you have a dry mouth, you're more prone to cavities. A lot of times we see discoloration and staining, specifically specifically with smoking, the tobacco does a really bad job. And even chewing tobacco, we see changes in the gum tissue because you start to see the precancerous change of that healthy, smooth gum tissue become kind of wrinkly and corrugated and gross. And that's really important that you let us know if that's a habit that you have, so we can talk you through options for kind of mitigating your damage and trying to eliminate that as a habit. In addition, smoking or vaping creates a lot of intense heat in the mouth. And so you actually get gum recession, you can get bone loss. It definitely impacts healing. And so if you're a patient that either just had gum surgery or had extractions, lost a tooth, or if you had implants placed, if you smoke or vape, that's going to cause a lot of problems with the healing process because it's dried out. The intense heat can actually cause the gum tissue not to heal well. And also, when you're dealing with implants or extractions, it can cause a decrease in the bone production, and it takes longer to heal, and the healing is not going to be as thorough and efficient. And so that's one thing to really discuss with your dental professional is if you're going to be undergoing extractions or implants, we really need to kind of figure out a pattern to get you to stop smoking or vaping for a certain amount of time, hopefully ever, but at least for a certain amount of time so that your body can heal adequately around the dental work that we do. So lie number 4 that we hear a lot is, I'm not stressed, I don't grind my teeth, I may clench every once in a while, but it's really not a problem. A lot of times when we find patients that have a stressful life, and let's be honest, who isn't under a lot of stress, the way that manifests itself is with nighttime clenching or grinding. A lot of times the patient isn't even aware of it, so it's not really a willful trying to not tell us the truth. They probably aren't even aware of the fact of what they're doing at night. A lot of times there are two main ways we kind of discover this. Either a patient has really worn teeth, so the back teeth are flat. Even the front teeth at some point will start to get really worn down from the constant clenching and grinding, and the patient will complain of headaches in the morning, sore jaw muscles when they wake up. Or a lot of times partners will tell us. So a lot of times husbands will claim that they don't clench or grind, and you'll look over in the corner of the operatory and their wife is sitting there shaking her head saying, no, I hear them clenching and grinding all night long. So these are habits that are probably even more dangerous than habits that you do when you're awake because you don't even realize you're doing them. So when you've got damage to the teeth from grinding and clenching, it's really important that we kind of proactively protect those teeth, because not only are you causing damage to those teeth, but that it's also potentially an underlying problem with sleep apnea or sleep disorders. And that's something that's become really big in the dental field now. And one of the first telltale signs of sleep apnea and disrupted sleeping is worn down teeth because the mouth is clenching and grinding at night, trying to wake you up and get you to open your mouth and breathe. Now the nice thing is that the solution to this is very straightforward. It's very non-invasive. The majority of our patients actually have night guards. We can make custom night guards for you. The way we design it in our office is bottom side facing the opposing arch is nice and hard and sturdy so that when you grind your teeth around, everything is nice and smooth, but the inside has kind of a softer lining, so when you put it in, it's comfortable. You can wear it all night. It's very sleek. It's a minimal addition to the tooth, but it's something that you can do. It's a small investment that you can protect your teeth for the long term. We highly recommend it, especially for any patients that have had crown and bridge work, veneers, any kind of aesthetic work, because that's an investment as well. We don't want you grinding and beating up on those teeth overnight and waking up with broken down teeth. So a night guard is a really minimal investment to help protect your teeth. So another adjunctive procedure that you can do if you're not willing to wear a night guard or are concerned that even with your night guard you're really clenching and grinding is the utilization of Botox. I know a lot of people only are aware of Botox for the cosmetic effect, getting rid of the wrinkles on your forehead, getting rid of the crow's feet, getting rid of the angry 11s, the frown lines. But Botox also does a really good job when we use it on the muscles of mastication. And so specifically the big muscle right here and the big muscles right here, Botox can do two things. Number one, it can reduce the tension so you're not able to clench and grind as well, which might help with headaches. But number two, the reduced force of mastication, of chewing of those muscles, is going to really cause the jaw not to clench and grind so much at night and allow the whole system of your mouth and muscles to relax, so we can kind of alleviate a lot of that wear and tear on those teeth and jaw muscles. So the cost for Botox, when we do it for cosmetic, is less of an investment than when we do it for clenching and grinding. And the main reason for that is because the cosmetic muscles, the ones through the forehead and around the eyes, are a lot smaller muscles, so they need a much less amount of Botox. These big muscles, the masseter and the temporalis muscles, they're clenching and grinding, they're big, strong muscles. So unfortunately, in order to kind of calm those down to a point of being therapeutic, we do have to use a larger amount of Botox. Each patient is on a case-by-case basis. You can't just give a one-size-fits-all prescription for Botox. If that's something you're interested in, come see us. I can sit down with you. We'll have a consult. I'll walk you through where the muscles are in your mouth, where the contraction is, where the strength that we really need to focus on with the Botox, and we can make a customized plan for you to really help alleviate that clenching and grinding at night. Long story short, you can lie to your friends and your family and your loved ones, but please don't lie to us, because we need to have the truth about your mouth so we can help you take care of it. One thing I'd like you to know that our office is a judgment-free zone, and what I mean by that is we don't care if you smoke, we don't care if you vape, we don't care if you drink $25 Diet Cokes a day. Everybody has habits. What we want to do is help you overcome those bad habits and help you have a nice, healthy mouth and a good smile that lasts a lifetime. I'm Dr. Brett Langston. I'm not here to judge you. I'm here to help you watch your mouth.
Down in Brookhaven with a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.